I don't know about your last doctor visit, but mine went something like this. I spent about 45 minutes in the waiting room and then about another 15 minutes filling out paperwork that I had already filled out about 10 times before. Then the nurse comes and gets me and she takes me back to the actual patient room where they're going to see you, and she'll take your blood pressure, she'll leave the room, and then you spend another, 10 or 15 minutes waiting on the doctor to actually get in there. When he finally does get in there, he spends about 7 minutes with you, but he spends about 6 of those minutes looking at a computer instead of you. And that 1 minute that he spent actually looking at you, it was to tell you when you needed to schedule your next appointment. You end up coming home with a bunch of new prescriptions that your insurance company either doesn't want to pay for, or if they do pay for it, your deductible is going to feel like a car payment. A couple weeks later, you get the explanation of benefits from your insurance company, find out that the deductible that you paid your doctor wasn't enough, that you owe him more, and a couple days later, you're going to get a bill not only from him, but probably from the lab and wherever else. Now it's 2026, and the headlines are telling us that artificial intelligence is going to fix all this. Now, if you're anything like me, you've heard the whole better and cheaper spiel before, and it usually ends up meaning that it's going to be more complicated and more expensive. So today, I figured we'd look at the facts. Is AI actually going to lower our premiums and save our lives? Or is it just a new way for the big three, insurance, pharma, and hospitals to pad their bottom lines? I spent this entire week digging into all the 2026 data that I could find. I'll share with you what I came up with, let you know my conclusions, and you can let me know down in the comments whether you agree or disagree with my assessments. So I'm going to go ahead and start off with some good news. Pillar one is quality, and this may be what we in the near future start calling the super doctor effect. So the technology is actually working. We've reached a point where AI is no longer a pilot program, and it's actually starting to become part of the basic infrastructure of healthcare. Here's a fun fact. Just last month, the FDA cleared new AI programs for handheld devices that can now identify 39 different cardiac issues, including heart attacks, using a single cable. It's essentially putting a cardiologist's expertise in the palm of your hand. Now, does that mean your cardiologist is going to be out of a job? No, probably not. It probably means you're going to go see him earlier, he's going to catch things earlier, and he might spend a little more time playing golf. Another fact I found, in surgical suites, AI-assisted operative reports are now showing an accuracy rate of over 87%. And you may say, 87%? You mean AI makes mistakes? Well, yeah, actually it does, but that 87% is significantly outperforming human-only documentation. And of course, AI is getting better and better all the time. In fact, exponentially better pretty quickly. And as I look around at my fellow humans, just as a species in general, I got to tell you, I think we might have peaked. Whether we've peaked or not is open to debate, but my take on the quality aspect of AI in healthcare is that it's not really about robots replacing doctors. It's more about giving those doctors, say, their own X-ray vision so that they can spot a spark before it becomes a full-blown forest fire in your body. Ultimately, helping them to catch things early and keep you healthy, and, possibly keep some of the extra costs from spiraling out of control. The second area where I think AI may actually improve healthcare is going to be in the personal empowerment or being your own healthcare advocate area. Really, that's kind of just a fancier way of saying that it's going to make medical jargon easier for us to understand. Now, for decades, we all complained about doctors' handwriting and not being able to read it. And then when they finally did start typing stuff into the computers and you could print out the charts and read them yourself, it didn't take long for us to realize that we could print it out, but it didn't really matter that much because it's all written in a language that only doctors understand anyway. Now, that's actually changing for the better. One thing I was able to find was that major health systems like one at NYU, I think it's Langone, Langone, I don't know how to pronounce it. Anyway, they're using AI to translate complex lab results and discharge summaries into plain English. And in tests, patient comprehension actually jumped by over 40%. Another fact is that as of 2026, 2/3 of physicians have adopted ambient scribes. This was proven by one of the largest rollouts in history at Kaiser Permanente involving over 7,000 physicians. These scribes are saving doctors about 3 hours of paperwork every single day. That is time they can spend actually looking us in the eye and hopefully listening to us a little more. So, the way that I see that playing out is perhaps it takes a little bit of the robotic nature of our doctors out, and perhaps it gives them enough time to become a little bit more compassionate, listen a little bit better, be a little more human again. And another thing, of course, that we now have the ability to do that we didn't have the ability to do a few years ago is you can go to your patient portal, pull up pretty much any lab result or report, copy and paste it into AI, and ask the questions directly. Now, I'm not by any means suggesting that you do that in lieu of going to see your doctor, but what I am saying is it can maybe answer some questions in between visits or help you understand things a little bit better. So, are you ready for the reality check? Because pillar 3 is the cost. And this is the one that makes my utopia alarm go off. Because whenever anybody starts talking about how new technology in healthcare is going to save the consumer money, my bullshit meter on a scale of 1 to 10 goes straight spinal tap to 11. So here's another fun fact. Administrative waste, that's right, the red tape of billing and insurance, now accounts for $1.3 trillion in U.S. healthcare spending. That is 25 cents from every dollar you spend. Now here's another fact. Hospitals are seeing a massive return on investment for dollars that they spend on AI efficiency. Some systems report that for every dollar they spend on AI billing tools, they get back $3.20 in efficiency. I gotta be honest, maybe this is just me being a cynic, but this is my take on all this. Hospitals are actually saving money. The insurance companies are using AI to process claims faster than ever. But are we seeing Medicare premiums or out-of-pocket costs go down? Not yet. So my assessment on the cost being affected is that AI is making the middlemen more efficient at taking our money, but unless some sort of legislation or competition forces these savings down to the consumer level, cheaper healthcare is probably nothing more than a corporate fairy tale. So ultimately, where I land on all this is I'm very optimistic about the medicine side of things, but I'm also very skeptical about the math. I mean, I love that my doctor is going to finally have time to talk to me. And I also love the fact that we're going to catch diseases earlier and that people will ultimately probably live longer. But until I start seeing my own bills go down, I just don't believe that consumer level healthcare is ever going to get any cheaper. In my opinion, all that savings that the companies realize from any use of AI is just going to become more profit in their bottom line. But that's just my take. I mean, what do you think? Are you willing to trade a little privacy so that an AI could possibly save your life? Or do you think that insurance companies are just going to use these tools to deny your claims faster? Let me know in the comments if you agree or disagree. I'll be down there responding. And if you found this video helpful, then hit the like button, the hype button, subscribe, do all the things and make the video do what it do. I'm Kevin. This is Refired, and I'll see you in the next one.